patients are like, yeah, this doctor could diagnose me with this, with this, with this. Finally, this doctor diagnosed me with Lymes, treated me, and now look at me, I'm good. But there's still this pressure from the IDSA that's, no, we want this physician's license pulled. And actually there were a couple physicians that they interviewed that wouldn't, they didn't want their identity known. They were interviewed in black, because they're like, if I treat Lyme disease aggressively, I don't want these other doctors to know, because then they'll try and pull my license. So I'm not sure what's going on.
I'll add to your conspiracy theory about why places like South Dakota and North Dakota and all these different they don't want the media hurting their tourism. Lyme's disease is a huge thing, especially with animals, believe it or not. I mean, I've talked to vacationers who I won't go there because I don't want my dog to get Lyme's because it's my, whatever, or myself. And if we're there, that's just one more thing against them. It's not like there's a lot of people in North and South Dakota anyway.
And the other thing they said is they thought that certain insurance companies preferred the IDSA standards, 2 to 4 weeks of antibiotics, because an insurance company, say if a doctor is going to prescribe a year of antibiotics, an insurance company's not going to want to pay for it. So they brought that up as a potential, so who knows.
Also broaden it to work comp claims, because you've got people working out in, doing, like you said, search and rescue, and all these people working, well, that just opens it up to work comp claims, lost wages.
Yeah, I used to teach first aid and CPR to the guys in Minnesota Power. And a lot of those guys that worked on the lines down, like in Carleton County, Minnesota, they were very afraid of this, because they'd had coworkers that had gotten Lymes. So they were very concerned about it. And yeah, if that happened on the job, then that's a big workers' comp claim, especially if the treatment's spanning a couple of years.
So how about preventive things like, putting front line up between our kids' shoulder blades? I mean, is that going to work?
Well,
it'd be nice, wouldn't it? If we had them?
That's what we should bring up. The DHS site does give some good recommendations for preventing tick bites. Using DEET and stuff like that, and
permethine or
yeah,
something like that.
And I'll bring that up. But here's the chart of the two-tiered testing system, where you have the enzyme test first, and if it's positive, then you go on to the Western blot test. But a lot of times they never get to the second step because the EIA test is initially negative.
And that test is not very accurate.
No.
My partner's a PA, and this is quite an issue up here in the North Woods right now. And she said the other reason they don't give you the blot test, which is about 75% effective in determining if you have it or not, is because that test is very expensive. And so what does that tell you? The insurance companies won't pay for it unless you have proof from the first test to go on to the second one.
And I tell people that have any of these vague symptoms, go get tested. If you get negative, get tested again. I had when I was teaching up at LSE, one of my paramedic students came up, and he was an outdoorsy guy, and he pulled up his shirt, and on his belly he says, "I just pulled a tick off here. It was just a red mark. It wasn't the target pattern." But he's like, "Should I go get tested?" I go, "Yep, go. Go get tested. If you test negative, test it again in a couple weeks, because it's not too reliable."
Actually, the cheapest thing to do is give them the 2-week course of doxycycline. The drug is extremely cheap, and so instead of giving all these expensive tests,
But there again, it goes back to why are we treating with antibiotics when our bodies are becoming drug resistant and these diseases
and that's been the only, and that's really been the only drug that's really proven effective against some of the tick-borne.
They're actually using a new one now. I just text.
Do you have the name?
I just texted someone to see if she'd give me the name.
Great.
So
thanks.
And that is a big problem as far as promoting resistant strains. But again, I think as a society, the way we should be attacking that problem is through clean products and feeding antibiotics to animals. We should be reserving it for disease treatment. And I always say to my when I teach people in first aid, they're just amazed. I'm like, because they're like, antibacterial soap's bad, I always buy antibacterial soap. And I go, I don't. If I'm going to clean a countertop, I'm going to use 10% bleach. And I ask them, I go, why are all these antibacterial products on the shelf at Walmart? Because people buy them. It's not because they're any better, people buy them. It's simple marketing, great American capitalism. You know, how do we disinfect an ambulance? Do we grab an antibacterial Lysol? No, 10% bleach, that's the standard. So I think that's...
But there are some diseases out there that 10% bleach solution won't touch.
Well,
Where soap and water will do much better.
Well, I'm of the understanding with like your acid-fast bacteria, that you gotta go 10% bleach.
Right. No, I'm not saying
And
it's not.
acid-fast bacteria are about your worst. They're about the toughest to kill outside the body. You know, HIV, hepatitis B and stuff, they're pretty fragile. So I don't know what could be
C.
more...
diff.
Okay, which is?
C. difficile? What? Go ahead. Yeah. Basically,
Is it a parasite or is it a bacteria?
No, it's a bacteria.
It's bacteria.
It's, but the peptide on the outside is so strong, you have to have dang near 100% bleach to kill it. You have to use almost, that's what the big thing is, that when you used to have to use the campsite wipes, right? That wasn't killing C. diff, and that was part of the problem when we were cleaning our ambulances, was we were still having C. diff in our ambulances. So now they come out with the bleach wipes, and that is what is the only thing. Alcohol won't, alcohol will kill HIV and all these other, but C. diff is just one that has to have a high
But we're still
concentration.
gonna treat that with an aseptic toxin, basically, not with an antibiotic.
Correct.
right.
Yeah. And that's my whole point. For cleaning, you know, for use of antibiotics, it should be disease treatment. You know, it shouldn't be pumping a turkey full of antibiotics and steroids to make it bigger. It shouldn't be selling everybody antibacterial hand soap when the studies they've done on hand washing, regular soap works just as well. I think that's where the big problem with antibacterials has come in.